I was very lucky to have a wonderful mentor in medical school who just happened to be an oncologist. And what impressed me the most at that point was the empathy and compassion at which he approached his patients, both patients he'd seen before as well as new people he was introduced to. And it was the first time I had really understood what it meant to have a true relationship with your patient, that what that really meaning was of the patient-doctor relationship. And then when you added the layers of the revolution in science and technology that accompanies this field, it really piqued my interest. And so then I ended up really taking a broader interest in it with the science behind it. But it comes down to the human element. It's one of the places where the bonds are formed the quickest, and they are lasting bonds, and they even last even beyond the states of the hospital or the clinic. Immunotherapy has been one of the many different revolutions that have occurred, have been presented in the field of cancer medicine, and its use has saved thousands of lives in the field, and it's really using our own natural innate ability to fight foreign bodies and cancer on our behalf, and it's a powerful tool, and we're only at the tip of the iceberg of what we can do with immunotherapy. There's a lot of exciting research focused on it, and together with genetics and traditional therapies like chemotherapy, we really have many, many more powerful tools now than we ever did, and this is reflected in this ever-increasing number of survivors that we have in the world for cancer. Targeted therapies have a vital and a growing role in the realm of cancer treatment. I think there is even growing evidence that they complement both traditional therapies like chemotherapy as well as evolving therapies like immunotherapy. And ultimately, knowing the complexity of what cancer is, it's going to take a complex solution to get to that point of cure. And it's probably going to take an armature, the whole bag of tricks that we have and all the different tools we have. And in terms of targeted therapies, the genetics revolutions that we had in the 90s and the human sequencing of the genome has opened the door to understanding those things that drive the growth of cancers. And by utilizing this information and learning how to sort of focus in on what's important and what's not just noise, we've created target therapies. We will continue to create therapies, refine these therapies, try to stay one step ahead of the cancer, which is always evolving and learning to bypass our therapies, but we are making we have the science behind us to keep ahead of it, and we are doing that in diseases like CML and many others. Breast cancer survival rates are measured in over a decade now, and many other cancers, and that's the goal, and the goal is obviously cure, and we're never going to stop until we get to that point. It's the resilience of human beings and hope, and we have more hope now than we've ever had before, and I'm really looking forward to a long career so I can continue to be part of it.